Hi, good morning, everyone. So good to see so many of us here. I think right now we have about 465 on Zoom, and I trust there are more tuning in via YouTube. I can see that the chat is being filled up, so we encourage you to continue to do that, to engage with us. We have truly an exciting topic at hand, don't we, in this time of pandemic? To start, we have 2 questions prepared for you. If you are familiar with Mentimeter, do head over to mentimeter.com and key in the code 68695668. You can also just click on the link available in the chat box. For those of you who might not be very familiar with Mentimeter, don't worry. We will flash out the question shortly, and you can just type in the chat box as well. So we have 2 questions, and we really want to know what you think about them. So let's flash it out so that the audience could also engage. For those who just came in, welcome. Good morning, everyone. So who are you? We would like to know among us here today. Okay. Yes, continue. We have about 39 people who have replied. So maybe the rest, we wait for a little bit longer. Okay, it seems that at this point, we have about 50-50 who are from the education field, as well as concerned parents and guardians. Okay, in the chat box, wow, we have plenty of parents as well. Doctor, parents, both. All right, great. Thank you so much. Thank you so much for your participation. A warm welcome to all of you. We have a second question as well, just to get your thoughts about the topic today, which is in particular to children's vaccination. So if vaccination is made available, would you vaccinate your child? Or you might not be sure about vaccination, or you are not keen at all to vaccinate. Okay, I see number 2, yes, number 2, number 1. All right. Okay. Wow, you guys are typing really quickly in the chat box. So I'm trying to catch up as well. A lot of 1 and a lot of 2s. Going to register soon. All right. Okay, we do have a little bit as well on number 3, not keen to vaccinate. All right, that's fine. Okay, so we will keep this poll open, and we will probably revisit this again when we go into the question and answer section. All right. So without further delay, let's continue to the next agenda. So thank you again for your participation. We will be watching a really short video, about 2 minutes, on Dignity, as I'm sure some of you might be wondering about who we are and what we do here at Dignity for Children Foundation. So let's watch a quick 2 minutes video on Dignity, and our co-founder, Reverend Elisha Savinda, we will come on right after the video to do a brief welcome and introduce our speaker, Dr. Amar-Singh. Let's watch the video together.
Hi, we are the Dignity for Children Foundation. Our vision is to nurture children of all ages to become world changers through education. Imagine a world where children grow up to become agents of change in their own communities. That's what we are after, and it all begins with education. Dignity's education programs includes a Montessori early childhood program for children aged 2 to 6 years old. By the way, did you know that we were the first Montessori preschool for the poor in Malaysia? We also have a Montessori primary program for children aged 7 to 12. We run a secondary education program for children aged 13 and above, and all our programs are taught in English. Teenagers in Forms 4 and 5 go through a dual-track program where they do the Cambridge IGCSE curriculum alongside mandatory skills development classes through our transformational enterprises. One of the highlights of this program is the 1-month travel and learn component. Students spend time away from home with their teachers in a farm to learn leadership skills, independence, and many other soft skills that are necessary to prepare them for their future. We know that quality education is more than just the classroom, so we go the extra mile to provide our children with transportation to and from school, daily meals, annual medical checkups, various supplementary workshops relating to health and wellness, weekly sports activities, and visual and expressive arts education. We also run teachers' training programs and an annual football tournament called the Faisal Cup. Our transformational enterprises are real-life learning classrooms for our secondary students. As of 2019, we have launched a cafe, a hair salon, a sewing shop, an art space, and a bakery. Alongside this, we also have 4 other skills classes such as graphic design, woodwork, computer programming, and urban gardening to provide well-rounded learning experiences for our students. We welcome you to join and journey with us to provide quality education for the urban poor to nurture them into agents of transformation.
Am I on?
Yes, Pastor.
Hi, good morning, everyone. So wonderful to see so many of you. Malaysia Satvinda, my wife Patrina, who is at the farm right now in Bentong. We've got a farm academy that we've begun in the last 7 months. So she is at the farm, and in a moment she's gonna just say a quick hello, and if she has got a line there, because the line is pretty challenging there. Pat, are you on? Okay, I can't hear her. Okay. In a few minutes, maybe she'll say hi. This is, I think, a very needy discussion. I think many of us who are parents, even non-parents, we are perplexed and anxious over different issues of our nation. Schools reopening, the health and the concerns of how are we going to manage all this. So I bring to you a dear friend. He doesn't like to be called by any of his titles, but for the sake of introduction, Dato Dr Amar-Singh, and he's got this part of the back. I've always think on his secret service. You can figure out. You can ask him after the seminar. Okay, but he has been a consultant community pediatrician and a child advocate. I'm sure you've read his material. I'm sure you've heard of him and maybe joined some of his talks. He was formerly the head of the pediatric department in the hospital in Raja Permaisuri, Bainun Ipoh, and the head of the Clinical Research Center, Perak. Amar, I know him. In fact, Amar, I think we are related. But I've always known his heart. So beyond his knowledge and experience is his heart for people and children. And that, I think, makes it an amazing combination. And actually, his wife is also joining us, also Dr. Im. She's at the background. So we want to say hi to her and letting us take the weekend away from you all. So without further ado, and I don't know whether my wife is still able to say hi. She just texted me. She said she can't say hi. She can't seem to get in, but a greeting from my wife to all of you and to Dr. Amar. It's going to be an amazing morning. So all over to you. God bless you. Let's have an amazing, informative time here.
Thank you very much, Satvinder. I've known Satvinder since the 1970s, I think, when he was still very young. And I want to thank Rebecca for making all the arrangements and all the people in the background who are actually making things happen, like Felix, Rochelle, Rennie, and others who I don't know who are live streaming this and doing things. Morning, everyone, and thank you for giving us your morning, on Saturday. I'm going to cover these issues largely on children and vaccination, and also talk about, how to get back to school safely for our kids. I'm going to share some slides so that you can follow. And I want to say that there is some resources for you, and I'll come back to that. And Felix, will you post the resources right now into the chat group? I'm sure this graphic here, which is from Samsia Hassani, who's an Afghan female street artist, the first one, which kind of reflects the situation all of us feel that we are in right now. She's a phenomenal artist. Unfortunately, managed to escape from Afghanistan before the Taliban took over. There's some caveats or some maybe things I should say before I start. That information for COVID is voluminous and it's rapidly changing. Even some things that I held 2 months ago have changed 2 months later because more data has come out. So we need to always be based on the science and the data. I see a lot of stuff coming through my WhatsApps, people sending me stuff, uncle, auntie, sometimes I'm not sure what to do with all of that, but I would like to say, try not to forward stuff unless it is data-based. I mean, there's some, either an authority or better still, there is research done behind it. Finally, of course, we need data transparency. Can't make decisions in Malaysia without actually seeing what is happening on the ground. And that's one of our difficulties. But recently, of course, data has become a bit more clearer for us. So as I said, there's a link that Felix would have posted into the chat group by now. There's also a QR code that you can scan if you want to. There are a lot of files inside, I think 15 or 16 files, but these are the 5 files that may be valuable to you. The top 4 are the most useful. I've got a children and vaccination fact sheet, which I've tried to update. I wrote it in July in great detail, and I tried the last 1 or 2 days to take some time to update it. Then I've also given you the Ministry of Health guideline for vaccinating children. That's a useful guideline, tells you who they will vaccinate, who they will not vaccinate, especially for those of you who've got personal problems or diseases in your children. I've got one short note on ventilation there because it's totally poor in Malaysia. It's one of the important things that we must do in schools. And I've given you some ideas how to work out what ventilation we need for our schools, giving you some calculators which are available online. Then my suggestions, a couple of pages on how to get children back to school safely. This will apply to all kinds of environments, from kindergartens to disability-run early intervention centers to secondary schools or even universities. And then I've got an older school SOP. I left it there because that was written in great detail sometime last year, and there may be ideas there that you want. I've got other files there, like building a resilient family and stuff that you may be interested in. Okay. So I'm going to give you a quick update on COVID in Malaysia. We need to understand COVID in Malaysia because it impacts children. Then I'm going to discuss children and vaccination, and I'm going to talk about Delta, a lot about Delta, because Delta is what has changed the face for children. And I'm going to talk about how vaccines work against Delta. And then I'm going to talk specifically about children and Delta and vaccine safety, and then go back to discussing children going back to school safely. So we all know our curve, whether it's 1, 2, 3, 4, 5 waves, it doesn't really matter to us. We're in a mess. There seems to be a dip here right now, but can I tell you that there's just a dip because Klang Valley is getting better, but 6 states are getting worse, and this is going to go up again for a short while before it will come down, probably by October, and settling more. But can you imagine, in the first year, we had 100,000 cases. Now, in 1 week, we have 100,000 cases. That tells you the magnitude of we have. And we know that this number is not the full number. You can multiply by 4 to give you the number of real infections that we have in our community. I wrote this in the press a couple of days ago because there's been a lot of talk about moving to an endemic phase. And here's how I view from the data where we are. We are now in a race against Delta. We're trying to push protection to all our adults with vaccination. And sometime in late September or early October, we will complete all the adults who want vaccination. Not every adult will take though. So there's going to be a gap in adults, okay? But meanwhile, we have 6 states, Penang, Perak, Kedah, Kelantan, Johor, and Sabah, especially Sabah in very, very bad shape. Penang is also in horrible state. And we are seeing rising cases of children all over the country. My colleagues who are in hospital all over the country are telling me they are seeing very sick children getting admitted. This can be small children who are on ventilator, a couple of months old to older children. Okay? Then we'll move to what I call a consolidation phase, which is November, December, by which time full-blown childhood vaccination will start. Some vaccination will start here in Sarawak and the Klang Valley, but here's when most of us will be offered vaccination, probably in late October, depends when we finish the adults, and we push childhood vaccination. And then we have to start thinking about the adults again. Is the immunity waning, and do we need adult boosters? And then we've got this thing to face next year. Why do I call it long-term danger phase? Because we don't really know with COVID. Nobody can predict what's happening with COVID. Are we going to get a new variant? Is that new variant going to evade vaccines? In which case, we're going to come back to a very difficult place. Not a square one, a worse than square one, maybe a square zero, because we have exhausted so much of our resources, even your energy and my energy. And of course, keep an eye on new vaccines. that may be helpful. And new, not just vaccines, new drugs, new ideas how to battle this. I want to say, especially for this talk and for us, the next Delta wave, I think my dyslexia is showing there, the next Delta wave will be one among children. Already we're starting to see the start of it, but somewhere between this period and this period, we will see a massive rise in children in Malaysia, especially if you go back to school, all right? So this is what's happening right now in the country. Klang Valley is recovering. Outside the Klang Valley, we're getting worse, and this will last for about 2 months until vaccination ramps up. We're uncertain what's happening in Sarawak. I'll say a word too about it because some of you may be from Sarawak. And we are now seeing a growing outbreak in children. And I want to caution us about looking at numbers for Malaysia as a whole. You must track your own state. I wish we can go down to district because that's what we're going to need now. And we need data to understand this. Let's skip that one. So you can see Klang Valley in blue coming down, but you can see the red line, which is those 6 states put together going up. And that's what we're going to be seeing for the next couple of weeks, 6 to 8 weeks. One problem I must tell you, and you must be aware when you look at numbers, is testing. And our testing is still very poor. It's been poor from the very beginning, something we have never adequately fixed. And this number should be 5%. Anything higher means poor testing. So most states are testing poorly, which is why we know that we miss a lot of cases. Now, I don't know how many of you have seen this new website. It's called COVID Now. If you just search COVID Now Malaysia, you will find it. It's produced by 4 lovely guys who are data people who are taking all the Ministry of Health data and launching this lovely website for us. And of course, I'm glad Ministry of Health adopted it. I hope they pay this lovely data people. And up here, you've got a lot of lovely areas you can click and change. I want you to help me. I want you to help me push that we want one button here for children. So when you click, we see children's data. Then you can look at what's happening in children in Perak, in Selangor, and so on. And you can see whether children are getting admitted to ICU, whether children are getting hospitalized. Right now, this data is good. We can come down to state level, but we don't have any age data except for vaccines. And we need to see the age data for children to understand what's happening over the next couple of months, even for longer period. I'm sure it can be done. It's just a matter of sharing the data with these wonderful developers. Okay, skip that. So let's come on to Delta. And we know Delta is our #1 variant. It is the variant spreading all over the world and in Malaysia. We don't do very much genome studies. From the little that we do, Sarawak is the best in doing it. So we know it's only Delta spreading right now. Right? Don't be worried about Sarawak numbers. The numbers are high in Sarawak just because the lab in UNIMAS is very good and it does a lot of genome testing. So the original Wuhan strain, 1 person will infect 2 people. Delta, 1 person affects 5 to 8. I think it's more on the 8 side than the 5 side from the way we behave. It's a very, very contagious virus which spreads very easily, very fast it spreads. And of course, there are other variants coming. Okay, so this is one question we need to answer, and lots of people have asked this question: is Delta more severe than the original strain? And yes, it is. And it's even more severe than the Alpha strain, which came from UK. And so this is a good study done from the UK showing it's 2 times as many admissions, which is why we're seeing more children, not just adults, being admitted. So you can anticipate that Delta is twice as bad as what we've seen before in terms of severity. Okay, what about Delta and vaccination? Does it work? And there's some, don't worry about all the things. Some of them are for me. These are the important numbers in this place here. And this applies only to Pfizer and AstraZeneca. It doesn't apply to the other vaccines. For Pfizer and AstraZeneca, we know that if you get the vaccine 2 doses, 14 days after the 2 doses, you can reduce your death by 10 times from Delta and reduce your infection by 3 times. Notice the difference here, huh? Okay, what does this mean? This means that you might still get infected, but you're not going to die. I have something down here that I want you to remember. If you're fully vaccinated with Pfizer and AstraZeneca as an adult, and even as a child later, 1 in 3 are probably going to get a breakthrough infection with Delta, which is why we're very worried about people who are vaccinated and then who, I have auntie who tells me, and now I'm happy to go to the supermarket because I'm vaccinated. I'll tell auntie, you please still maintain all your precautions because you can still get a breakthrough infection. And that may come back and infect your grandchildren or infect somebody else, or a few might still go on to get severe infection despite having the vaccination. So the vaccine works very well in case you're confused with all the different WhatsApp measures, but Delta definitely can still break through and infect you despite the vaccination. So 1 in 3 breakthrough. Huh? Especially the ones we're worried about are the ones like policemen, the people who sell food to us, the frontliners who are more likely to get infected. So some people have been sharing this data and saying, Israel, the cases going up, hospitals are going up, so maybe the vaccine don't work, but in UK, it seems to work. Let me show you a bit of data from Israel. This is the data that people are showing, but this is the real data when you break up by age. Trust me that statistics is a bit of a problem with data. There's something called a Simpson's paradox, which you don't need to know at all about, but this data is the wrong data to show, because when you break by age, the Pfizer vaccine works well. It is still working well. As I said, protects you 10 times better than without the vaccine from hospitalization. Same with UK. UK is very, very good. They publish data every week for the public to look at. And this is AstraZeneca and Pfizer put together. And for Delta, it is still 96% effective there. Okay, so definitely very, very good. But for infections, it's dropped. Okay, so 1 in 3 will still get infected. Right. Now in our country, we've been seeing this kind of data being circulated since we had data being released 2 days ago. This is misleading data. Don't look at this. This doesn't work. This data doesn't work. There are reasons statistically why this doesn't work. We need the right kind of data, and people are trying to generate that for us. Similarly, we see this kind of data posted every day. It used to be like this. Now they've moved to this kind of graphic. Don't take this data as effectiveness of vaccine, because this data is at the beginning of the person's infection, not when he is discharged from hospital. So I want to say that we need good kind of data like this from UK, which tells you at the end of your admission, after your discharge, how effective is the vaccine. All these are not giving that answer to us. Okay. All right. So let's summarize. Every once in a while, I got a pink slide to try and summarize for you in case I've given you too much information. So I want to say here that for the Delta variant and vaccination, for these two vaccines, the Pfizer and the adenovirus vaccines, Pfizer and AstraZeneca, you can get infected 1 in 3, but it's not going to be so bad for you. You're generally not going to get ill, but you can transmit. Okay, so we must treat the vaccinated like the unvaccinated. I don't believe in a vaccine passport just yet. I believe everybody should behave the same way. And please keep your behavior if you've been vaccinated. All right, first thing. Right. What about Sinovac? Everybody asked me about Sinovac, and we need to talk a bit about this because you're adults here, but we need to think also about children and Sinovac as well, because some people are keen to get their children vaccine with Sinovac. There was this Chile study that everybody quotes with but this is pre-Delta, and it showed very good results, just as good as the Pfizer results and the AstraZeneca results. But we don't have good data of Sinovac and Delta. There is a little bit come out of China, but the sample was very, very small for hospitalization. And you notice here, Delta against infection, not as good as Pfizer and AstraZeneca. It looks like 40% can still get infected despite having 2-dose Sinovac. But some better against moderate disease, but we don't really know about severe disease because the data is too small. We have some data from Thailand, Indonesia saying their health staff are getting infected and they are starting to give them a booster. That means this Thai health staff were given 2-dose Sinovac, same Indonesian health staff. Now the Thai government is giving them AstraZeneca booster and Indonesian government giving Moderna. But this data is just media reports. We don't have hard data to look at. There's one from Thailand looking at the antibodies in people who received their staff who receive Sinovac. This is the name for Sinovac, Coronavac, and it doesn't look as good. Okay, so the problem of looking at all this data is that there's something called cellular immunity. There are 2 kinds of immunity in our body. One is the antibodies, which everybody talks about. Not enough people talk about our cell immunity, especially the T cells. And this one is not measured by many people. This is the cellular immunity that may be more important. And we don't know this for Sinovac. We know it better for Pfizer and AstraZeneca. So how will we understand whether Sinovac is doing well or not with Delta? We look at Sarawak. Why look at Sarawak? Because 79% of people in Sarawak receive Sinovac. Okay, and you can see in Sarawak, this blue line, the dotted blue, look at the trend, that blue line, that's the number of infections in Sarawak. And you can see as the Delta wave hits Sarawak, the infections have gone up. And the red line is the admissions, and you can see the admissions also have gone up. Okay, all right. Here is looking at ICU, the blue line, and here's looking at deaths. So from Sarawak, it seems that despite having a very high vaccination rate and because of Sinovac, there seems to be sufficient breakthrough, which is why if you look at the media yesterday, the ministers there are talking about should we give a booster to our Sinovac people or not. The answer is still not out yet, but they're thinking about it. So what's my summary for Sinovac and Delta? We need a lot more data. We're going to get this from Sarawak probably by next month, okay? And if Sinovac breakthrough is causing severe illness, all the Sinovac recipients will need an mRNA vaccine, which is probably a Pfizer or AstraZeneca, one or the adenovirus vaccine. We're not going to use it for children. Why? Because there's no data at all for children right now. So we can't use that. Okay. So right now, Sinovac, I think for those who are adults, you've got to keep watching the data and to see whether we need a booster dose or not, but definitely not for children. Okay. Now, this is also just think about herd immunity. Can we, get sufficient herd immunity so we don't have to vaccinate children? That was my original hope, that we can get 70% of our adults done, or 70% of the population done, and then, the virus can't spread so easily and we can protect children. But now with Delta, herd immunity is not a possibility because even the vaccinated can get infected, 1 in 3, and they can spread it. So this is a concept that many, specialist people internationally have all abandoned right now. Okay. Here's good data from Australia where they calculated what they need. They said if 70% of adults are vaccinated, we could get millions of cases. If 80% of adults, we're still going to get a lot of deaths and cases. We need to vaccinate not adults, but the whole population. If you get 90% of the population, then only we can cope. So you look at the kind of numbers they're talking about right now. They're saying that we need to vaccinate a huge amount of the population. And like Malaysia, Australia also has got a sizable children's population. Our population is 30% of our population is children. Theirs is probably about 25%. Children. So even with that, we're going to have some problems. So we stop using the herd immunity concept and we think of using high vaccination of the whole population, not just adults. Okay, so let's move on to where you are most interested in. And this is another graphic art. This is one from Malaysia. She draws everything on mask. Quite interesting. People have appeared during this COVID outbreak. Really innovative. Okay. What's happening with COVID in Malaysia? We have some data. This is pre-Delta in last year, and we had very few cases with a higher mortality. This year, we had a lot more cases, as you can see, and more deaths, and this kind of mortality. So I want you to remember this figure: 1 in 7,500. Okay, that means this for 7,500 children who get infected, 1 will die, which is not very high. Adults 40 times more likely to die than children. Okay, but much of this is pre-Delta. Even this data here is merged with a bit of Delta, and a lot of it is pre-Delta. So we need to actually ask for data to come out month by month, like they do in the UK, so that we can actually see how this changes for our children. I want to say from the same data that the 0 to 4 age group is as bad as the 13 to 17 age group. These are the 2 age groups that are worrying. This is where the deaths occur and the severe illness occur. Not just the teenagers, but the very young. The in-between group the primary school group seems to be doing better. Okay, what do children die of and why do they get sick of? They get this condition. This is something called a Kawasaki-like disease. Many of us as pediatricians are aware of Kawasaki disease, and this is called a multi-system inflammatory disease, and it attacks the blood vessels of the children all over the body, the blood vessels in the skin, the blood vessels in the heart, the blood vessels in the brain. And we are seeing a lot more of it in the last 1 month as the Delta is rising in children. And this is what actually kills children. Okay. The second problem in children besides death is something called long COVID. I hope all of you know about long COVID, are reading about long COVID. It is a problem in adults. At least 10% of adults get long COVID. We're not sure how common in children. Okay, the figures are between 2 to 10%. The latest study from UK is quoting 14%. Right now in UK, they are saying 1 in 7. I'm always a conservative individual, so I say 1 in 10 is the figure that we should remember. And what does long COVID do to children? It damages them long term. They can't go back to school. They're difficulty concentrating. They can't sleep well. Some of them get long-term lung and heart damage, which may be permanent. Okay. Right now in Malaysia, 60% of our adults who are discharged from ICU have long COVID. Okay, and some die after the discharge. So there's growing evidence that this is a big problem in children. So what's happening with children in Delta in other countries? This is Norway. They have a very high vaccination rate as well, with 70% at least got 1 dose. They opened schools 2 weeks ago, and you can see this huge rise, and all in children. They stopped using masks for children. They had no ventilation in school, and there was no distancing. A mess to open school like that in the face of Delta. Okay. Indonesia had a Delta wave just before us. they had more than 1,000 children die. They say 100 children die every week, and the mortality was much high. One reason is because so many children got sick, they couldn't have enough ICU, pediatric ICU facilities for the children. Here's the US, and again, they have very high vaccination rates, and even they have vaccination among their 12 to 17 years, 42%, at least one dose. And when they open schools, they had this spike again. Again, because some schools use masks, some don't use masks, some have ventilation, some have no ventilation. 1% got admitted and with a mortality. And here's UK, just opened schools this week. And you can see this green line here. That's just see, they give us graphs for every age group, which is what we need for Malaysia. And you can see this spike, which is the 10 to 19 age group, spiked 42% just in 1 week in going back to school. Again, not enough mask use and no ventilation adjustment yet. What happened to us? Here's Sarawak in early August. We've got an up spike of children, 29%. And here's Sabah just 2-3 days ago, 37% of all the cases were children. So last year, you probably see 20% children. Now we're seeing 35, 36% children. Next month, you might see 40% children if you keep tracking this. So definitely the pandemic is shifting towards children. And in states which are fully vaccinated or better vaccinated, like Klang Valley or Sarawak, this is going to be even more pronounced. When Delta cannot go to adults, it will go to children. All right. So here's my summary for you in case that was too much. Our current thinking is that everybody will get infected over time if not vaccinated. Even some of the vaccinated will get infected. And the next Delta wave is among children in Malaysia. And for children who get infected, these are the numbers I want you to remember. I made it very simple. Okay, 1 in 10 will get long COVID, probably higher. 1 in 100 will get hospitalization, probably double this. 1 in 10,000 will die, probably again higher than this. Especially if you run out of ICU beds. Our children's ICUs are worse than adult ICU development in the country. So we may run out of children's ICU beds. And so, you know, it may be already now it's 1 in 7,500. But I put this figure so it's easy for you to remember, but it's probably higher than these figures. Okay. Our problem is that even if you want to vaccinate the older children, what are we going to do about the 0 to 5 children who have a high mortality? And I'll try and answer that question as we go along. Okay. So children and vaccines is what I'm coming to next. Which vaccines are available? Right now, we have only one vaccine in the country available to you. Okay, this is the Pfizer vaccine. There is good data published on the 12 to 15 age group, and of course, the older good children as well. WHO has approved, the World Health Authority has approved this for use in children, and is used widely in many countries for children. For Sinovac, as I said, no published data. China is using, but no published data for SCC. And I want to also point out to you that the Sinovac company has not submitted any documents to our Malaysian Drug Authority for use in children. So it's not going to be available for use in children. AstraZeneca, Novavax vaccine, I want to keep an eye on, and other vaccines are doing trials in children 6 to 17. Even Pfizer is doing trials in small children. None of this data is available for us to look at yet and not being used by other countries. Okay, so what's happening in different countries? I just showed in some countries, US using 12 to 15, Canada 12 to 15, France 12 to 16, Germany using, Singapore also started vaccination, as you will know, Japan, Cambodia even started a vaccination. But what about UK? UK is an outlier. They were doing, they did 16 and above. They didn't use 18, they used 16 and above, and they were doing that. They now allow 12 to 15 only with illnesses. So if you're a 12, 15-year-old child with a heart disease, lung disease, immune compromise, then they vaccinate you. But they're not doing the general public. They're getting heavily criticized by their scientists, their pediatricians about this, this policy. And the next 2 weeks, when schools continue to reopen, they're going to get a crisis because they have not vaccinated their children yet. Many people have spoken up seriously about this. Here's Cuba, which is really interesting. They've got their own vaccine. I don't even know the name of this vaccine. They produce a homegrown vaccine, which apparently is quite good. And they've started from 2 to 11. They already were doing 12 and above. So it's gone down to the really young age. And similarly, China is using Sinopharm and Sinovac. And in August, it started 3 to 14. Again, we have no data for these groups about how good that vaccine is, how safe that vaccine is children. That's why I put them in a different color there. All right. So a lot of countries, everybody using Pfizer, but there are some countries, like even Indonesia is thinking of Sinovac, and Cambodia thinking of using Sinovac for children as well. All right. But as I said, without data, our country is not going to approve those vaccines. So what are we going to do? What about vaccines for children under 12? This is your question that many of you have asked. I was impressed with the number of questions sent through to us, with more than 70, 80 questions sent through to us even before this talk started. And, Pfizer, as I said, and other companies are doing trials right now. I understand from listening to experts online that FDA, the drug authority in the US, has asked Pfizer to push their time a bit longer, watch for 6 months for side effects. And so the data may only come out in early 2022. It's supposed to come out in November, but now may come out in January for us to know whether Pfizer works in children and what dose to use. Okay. Again, these I'm hoping for data, but we have no data. Is Pfizer safe to use in children? So I'm coming now only to Pfizer because we don't have access to the other vaccines. We don't have data. We're not going to use them. So Pfizer is being used in more than 10 million teenagers worldwide, a lot more than that, okay? US alone, 9 million. The major side effects are the same as we've seen in adults, the common ones: muscle pain, headache, tired, fever, some joint pain, especially after the second dose, okay? And you can go and see this on the US sites. They will give you the children's side effect numbers as well. And this is common, all right? Okay. Then there are severe rare side effects, which are largely allergic side effects. And that one is probably 1 in 100,000. These are people who are going to get a nasty allergic reaction to the vaccine, which can happen to adults as well. We can predict some of these children if they had previous allergic reactions, and those are the ones should be vaccinated in hospital or in a good health facility where there's a resuscitation available. But the majority of children can be vaccinated safely in the normal clinics, but this is one that you should remember. The major side effect that everybody should know right now, been talked about enough, is inflammation of your heart. That means it's well recognized that Pfizer causes myocarditis, inflammation of your heart muscles, okay? And it's especially with the second dose, especially with boys. And this is the number you should remember. 1 in 20,000 children is going to get myocarditis. So if you vaccinate 20,000 children, 1 is going to get heart inflammation with Pfizer. But this is the heart inflammation if you get COVID. If you allow 3,000 children to get COVID, 1 is going to get heart inflammation. And this heart inflammation is much more severe. It's the one I talked about earlier. This is nasty. You probably end up in ICU. This one, the majority don't end up in ICU. They're just in general ward and they go home well. So far, all these have been monitoring. I think there's 1 death in Israel. There may have been 1 death in the US. But by the way, with me, I always give you data. I won't lie. Okay. Although US hasn't quoted that death, but it seems that it's possibly 1 death in the US. Okay. But most of them admitted and go home well. Okay. What about long-term side effects? People keep asking that, will the mRNA vaccine, this Pfizer vaccine, change my child's DNA, do something to them, down the road? Most vaccines in the history of mankind, all vaccines so far have shown all their major side effects within 2 months. And you can see here now, the FDA in the US has asked for 6 months before they release the younger children's data because they want to monitor this. So we don't anticipate any long-term side effects. Nobody can give you 100% foolproof answer to this. One question I've always had in my mind: what will happen to these children who have myocarditis? They recover now. Will there be some long-lasting cardiac problem later? Even the cardiologist cannot answer this question for me, and so I cannot answer that question for you. Okay, something at the back of my mind that I think about. So I've tried to put here a graphic of the risk-benefit. When we want to vaccinate children, we think of risk and benefit, even adults. Okay, on the right here, the blue-purple one is the risk of the vaccination. Here, if you don't get the vaccination, and this is 1 million boys. Why I choose boys? Because of the myocarditis problem with boys. Okay. And we don't really know how many are going to get infected. This is a conservative number, very small number getting infected, maybe 5–10% getting infected. But here is everybody getting vaccinated, 1 million getting vaccinated. 4,000 will get mild side effects that we will report. These are the most severe ones, not a simple headache and fever. 50 will get myocarditis. 3 were admitted to ICU. We don't know about this, but it's possible. I won't lie to you, it's possible. Okay, all right. Whereas on this side, we will get a lot of people with long COVID, a lot of hospitalization of children and so on. And if we allow every 1 million boys to get COVID, the hospitalization will be 10,000. Myocarditis will be 333. Don't know how many ICUs we will get, and we'll get 100 deaths at least. Okay. So when I look at this, with Delta, this is looking at Delta, the risk benefit actually is for the vaccine, not for COVID. All right. And I've shown this before, but I want to show this again to you as parents and as professionals, as people who are thinking of children. We are worried about this small dot here. That's a side effects in our children. And that is side effect, I would say, it's about the size. Actually, I should make it a little bit smaller for the severe side effects, probably about this size for the myocarditis side effects in children, 1 in 20,000. But here is deaths from COVID. And this is assuming we have all the ICU care that we need for children. If we don't, this is going to be higher. Okay. This is long COVID, huge, even in children, 1 in 10. And yeah, remember UK, 1 in 7. This is the impact on our lives. And I think this is wrong. I should make the whole thing gray, isn't it? Our lives are completely turned upside down, and children have a lot of long-term. I'm seeing more and more data come up from different countries now about the long-term psychological damage on children, what we call post-traumatic stress disorder in children, anxiety and depression in children, coming up to rates of 20-25% in all children right now. And finally, we have this, what we call collateral deaths, children and adults who couldn't get access to healthcare with other diseases because our ICUs are full. We don't know this number for adults, and we don't know this number for children. And we know that suicides last year increased, especially in teenagers, and we're worried about that, doubled in teenagers last year. So think about that when we think about the big picture about vaccinating children and you're thinking about safety. The one thing you must read about always is myocarditis, okay? So 1 in 20,000, higher in boys. So the boys, you probably could quote, 1 in 10 or even 1 in 6,000 rate in boys, all right? Now, is it safe to use in children with chronic illnesses? So now we're not talking about side effects. We're talking about, okay, my child's got diabetes, my child's got thalassemia, my child's got leukemia, my child's got asthma. Can I use? I want to say that there are these two guidelines. The guideline on the left is the third edition guidelines for everybody, including adults. The guideline on the right is the one that I just included in the link for you, which is for the 12 to 17 who planning to vaccinate. And inside the guideline, they have given this kind of a table, a couple of pages of this saying for this condition, for this condition, this condition. Okay, but let me summarize that for you. Any teenager, 12 to 17, who's got a medical condition, a chronic condition, asthma, diabetes, hypertension, thalassemia, actually has a higher risk from getting ill COVID. So they should be prioritized to receive vaccine. In fact, we will vaccinate children who have chronic illness first compared to those who don't have a chronic illness. Okay. And of course, right now, only Pfizer approved, and there'll be a 2-dose, 21 days apart, and they're using 30 micrograms dose for these children. Okay. So look at this list if in case you're thinking of your particular child. As I say, it's a longer list, and look at it. What are the precautions that they're going to take? What are the precautions we should take? There should be a pre-vaccination assessment for some children. Who are these children? Any adolescent with severe allergy, as I mentioned. We want to make sure where we should vaccinate them, whether we should vaccinate them in a hospital or in the clinic. And there may be a small number that we will choose not to vaccinate, especially if you have a very, very severe allergy, the kind of allergy which, you collapse and you stop breathing and you turn blue, and that kind of allergy with other vaccines, okay? Then there's adolescents with increased bleeding problems. That means people who have got a hemophilia or on drugs that make you bleed more. This one we just want to know because we should put longer pressure on the site of injection so you don't get a blood clot there. And finally, the ones that we need to worry most is the immune-compromised individuals. In adults who are on chemotherapy, children on chemotherapy, children on drugs that suppress the immune system. Most of them probably will get the vaccine, but we probably need to go to a 3-dose schedule. This is really recommended for adults. We should not give 2 doses to them, but give a 3rd dose to try and boost their immunity. Okay. Now, what about you? What precautions should you take? If you choose to use Pfizer in your children, I would say, one of the key things you should tell your child is don't do any strenuous exercise 5 to 7 days after vaccination. Okay. This is to try and reduce the pressure on the heart. The peak day for the myocarditis is day 4, but I think we should do 1 whole week. I will say the 24 hours before the Pfizer also take a break. Don't run around, don't exercise, don't anything. There was one child in Singapore who got very ill. I think he had a lot of cardiac problems because he actually went back to gym, exercises very soon after his Pfizer dose. So avoid this completely. After that, you can go back to, increasing your exercise. As I said, 24 hours before as well. Don't use any drugs before your vaccine. Your normal drugs are fine, the one your child is normally on, but don't use Panadol, or don't use any aspirin or drugs like that. You can use them after in case of pain, but it's not recommended before. Okay. And finally, you should monitor for myocarditis. You should keep an eye, not just for boys, for girls as well. And inside that guideline that I mentioned, that MOH guideline, they've got a flow diagram, which is on the last page. I would recommend that you snapshot that, because they are saying these things to you. They're saying that if you got chest pain, breathlessness, your heart beats fast, or you look like you're getting fatigued or fainting, or you got tummy ache or nausea or vomiting or low-grade fever, all these are new things, huh? Okay? Or you have a combination of symptoms, you should go and see a doctor, and he should do an ECG or look out for myocarditis. So your doctor may not know this, by the way. Many of them may not have read this guideline. So it's important that you have access to this guideline to show your doctor what you should do. Huh? Okay. I would expect that straight after the fever, you get straight after the vaccine, you get fever for 1 or 2 days. That's probably okay. It's the subsequent fever that you develop that I think we will, a new fever that develops maybe on day 3, day 4, that is a problem for this kind of thing. Okay. So I've got a summary table. You see, solution notes that I've given you a link. I'm not going to go through it, but I want you to remember again those 3 figures that I gave you: 1 in 10 long COVID, 1 in 100 admitted, and 1 in 10,000 dying from COVID, which is why I'm supporting vaccination right now. Okay. Okay. So my summary from all that for children COVID and Delta, I think we should push for a separate data set so we can monitor all our children, vaccination, the side effects of vaccination, the infections in children, so we help parents make decisions well. Even 2 months ago, you asked me, I would have said, I'm cautious about vaccinating children. Now, after seeing the data in Delta the last 2 weeks, I myself am supporting the vaccination of children 12 to 18. So when vaccines available, I would, encourage you to get adults to get vaccinated. Of course, if the adults are not vaccinated first, I would say get the adults done first, and we choose safest vaccine. Why did I talk about Novavax? Novavax is a vaccine that's been produced with a good safety profile and very effective. And I hope that when their trials come out on children, that may be the vaccine that we might use for younger children. So we don't have data yet for under 12. We will have to wait for the data and try and use the safest vaccine that we can find, okay, for this age group. Now, I'm going to talk about schools right now. But before I talk about schools, I want to give you some general principles about reducing COVID risk in ourselves. And these are the 3 major principles that you should remember. Remember that you cannot prepare enough for Delta. If you think that you're prepared, you prepare even more for Delta. And first, you must reduce your viral load, okay? And to do that, you need a good mask, I'll talk more, a face shield, and limit your exposure. That means don't actually, take unnecessary risks to meet other individuals. Secondly, you must reduce your severity, get vaccinated even for children, maintain your fitness, and if you think you're infected, you must get tested early. And thirdly, we need to work as far as possible to, change the ventilation, find the people who are infected and isolate them. I can talk more if you need. Huh? I'm trying to persuade the government to move away from SOPs to a lifestyle change, because I don't see us ending anytime soon. And we need to make these things lifestyle: mask, ventilation, social interaction, minimization as lifestyles. Okay. And we should be able to enforce it among each other. We don't need a policeman to tell us. If you see somebody pull his mask down, you say, hey, put your mask up. We should become something second nature to all of us to do to each other. So let's talk about going back to school and getting children back to our schools, okay? Again, there's a file for you on this, just like there's one for vaccines, and I hope you see it. The key to bringing children back to school is 3 things, okay? Besides what I talk here about keeping COVID down, which is critical, we need to maintain a strong focus on preventing staff and children from getting infected so they don't spread to other people. Okay, I always say the key for any one of us is don't get COVID. When you get COVID, then problems start. Huh? Secondly, teachers must work with parents. I think any school that doesn't work with parents is not a good school at this time. Parents must know the safety measures and must be involved with the school and support the school in getting safety measures in place. And thirdly, please don't forget children from poorer families. If we don't support them, it'll affect our own children. So please support children from poorer families. The focus must be airborne now. We don't focus just on surface, we focus on airborne. And remember this: ventilation, ventilation, ventilation. So let me talk about specifics. It's not just enough to talk about schools. You need to keep your home safe. I call these 3 bubbles here: the home safety bubble, the class safety bubble, the trust safety bubble. There could be one more, the work safety bubble. I need to trust you to keep your children safe at home so that, my children are not affected. At the same, that is home safety bubble, a trust bubble together, a work safety bubble so that dad or mom don't get infected and bring it home and to the school. And lastly, a class safety bubble. Okay, so there is no safe number to meet among us. So let's not necessarily meet our neighbors or do other things right now. Now, there are basic issues which I put up in the earlier SOP, which I'm not going to repeat here. But I want to say here, notice one thing I crossed out. None of us believe in temperature check at entry anymore. It's meaningless. I think we should abandon all this temperature check at when you go to buy makan or when you try to enter any place. It's meaningless. But temperature check at home is useful. When you check your own temperature and you got fever, don't go out, stay at home. The fever persists, get tested. Okay, that sort of thing is good. So if you are a child, it is important that parents actually monitor children at home and not send a sick child to home. Okay, rather than have that check done in school. All right. So I'm going to go through each of the areas, and as I said, there's a file on this, so I may not cover them in full detail, but I can come back to any area that you like. Okay. As I said, there's a trust bubble here, and what does this trust bubble mean? That students and parents have responsibility towards teachers. As students, as children, and as parents, we protect our teachers. So we don't bring unwell children to school. Even if I'm unwell as a parent, maybe I should hold my child back just to make sure they don't become unwell. Okay, so let's say I'm a parent, I've got a cough and a cold, running nose today. Maybe my child also shouldn't go to school today. Definitely my child got cough, cold, running nose, shouldn't go to school, fever, shouldn't go to school, all right? Okay, if any parent or child becomes positive, you are in contact with someone positive, it's your responsibility not to go to school, quarantine yourself, and immediately tell the school. You mustn't hide this information. Okay, this is our trust bubble. So if your child, for some reason, or you have been infected, you keep your child at home, inform the school immediately, and they will then, what they will do, they will actually have to look at all the children who have been in contact with your child. Okay, what is the teacher's responsibility? They actually must monitor the health of all their own staff. And the moment any staff has been in contact with someone who's positive or who has been infected, should inform all the parents immediately. Sometimes school hide this information. Is not acceptable anymore. I think any school hide this information. We should, we should bring it up, maybe even publicly, and say this is not acceptable. So if you've been in contact, you're positive, in the WhatsApp group with all the parents, tell them, hey, so and so have been infected. This class cannot come anymore to school until we figure out what is happening. All right. So the school needs clear lines of action, for what to do with the class, what to do with the teacher when the class can reopen. Okay. I worry about traveling. Once you start traveling, let's say you're in KL right now and things are settling, and then you travel from KL to Perak. Perak is in a mess, and you go back. I wouldn't let you come back to school. Actually, if I was the headmaster or headmistress, I would get you tested first. Make sure you're safe to come back. The second thing I would do besides these trust bubbles is a mask for everybody. Any child above 2 is encouraged to wear masks. Definitely by 5, all children can wear masks. I think children wear masks better than adults wear masks, in my experience. Once we train them, adults are the ones who keep fiddling with their masks and pulling them down. Again, have a mask which has filtration capacity and minimum leak. So you need a mask that focuses on quality, good filtration, minimum leak. Okay, a normal 3-ply surgical mask has side leak, and you must fix it. You must fix it with a knot and tie or a double mask. The surgical mask inside and a cloth mask outside. A simple surgical mask alone today is no longer something we would accept for Delta. Here's me. I have a good mask. This is an K94 South Korean mask, which is reusable with the alcohol spray. And I have a face shield, and I wear a cap to prevent draft from coming in above. Okay. So I'm double dose Pfizer vaccine. I don't put all my eggs in the vaccine basket. I take measures to prevent myself from getting infected. So we need masks for everybody, and we need to think this through with all the parents as teachers and make sure that everybody has got the same quality and capability of wearing masks. And again, here's where poorer children must be supported. I see sometimes adults wearing the same dirty 3-ply mask for days because they don't have the money to invest in more. It's time for us to support them. Okay. The next thing is a class safety bubble, which means we don't let children from different classes mix with each other. Okay, whether they are kindergarten, primary school, or secondary school or university, we keep them in their class bubble. They do everything in their bubble, so that if one person is infected in here, we shut down that class. We don't shut down the whole school if you want to get back to school. Otherwise, we'll be shutting down the whole school intermittently, and there's no point going back to school. Notice these are things that I said are the minimum. These are the must do, the minimum. Okay. What about the other minimum things? We still need to worry about contact surfaces, and definitely anything that's frequently touched, like the handrails, the doorknobs, the toilet sinks. These should be cleaned often with alcohol, 70% alcohol. And of course, the tabletop of the children, the chairs that they sit on, I would clean, especially if you've got two classes, one using the class in the morning and one using the class in the afternoon. I think that's even more critical. If possible, try not to share classrooms at this time if you can. And for younger children, we should clean toys, okay, before use. Ideally, we should actually move to toys that are easier to clean right now. Okay. The other basic thing is use ventilation, improve ventilation. I think we still need some distancing in the classroom. This plastic things that people have put up now are no longer recommended because they actually build up aerosol particles. They don't actually, allow them to clear so well. So people are no longer recommending the separator, plastic separators, okay? And we want to maximize outdoor air. So you keep your doors and windows open as far as possible. Put a fan that's outward facing to suck air out. If you can, invest in a wall fan that you could put in. Your aircon and fan that's blowing across the room, you've got to be careful because you may spread particles from one child to the other child, and you need to think about that. I'll talk a bit more about ventilation in a moment. Okay. The other thing is hybrid learning. That means you must prepare that sometimes you will transition to half the class being in school, half the class being at home. Or maybe sometimes when somebody gets infected, we move back to online. So we must be prepared to move flexibly to move between that. And this should be discussed with parents as we go along. Okay. I'll come back to ventilation fully in a moment. Okay. The enhanced message, those are basic, must do. Enhanced message is all teachers must be vaccinated before you go back to school. This includes security. This includes the bus scholar man. This includes the canteen people. Otherwise, this is the minimum I would expect. Okay. Enhanced message. All parents also should be vaccinated before we send children back to school, my opinion, because that reduces the risk at home for the child getting infected. I also believe that if we cannot vaccinate children, and even if we can vaccinate children, we should move to weekly RTK antigen testing. Now, I've been trying to push for our RTK antigen testing to come down to below 5 Malaysian ringgit. If we do that, I think we can then enable every child, every teacher to have an RTK antigen test before going to school. When should we and where should we do this test? I think we should do this test maybe on Monday or Tuesday, after the weekend. I would like to do it at home, so we don't have to crowd the school. But not everybody may have the ability to buy or do this, and so you may have to do it in school. If you do it in school, make sure you don't have a whole bunch of children queuing up to do this, and then you increase their risk of spreading COVID by them meeting together. Okay. Some of my colleagues have been doing this for factories, and not a single outbreak. They do one test a week. In the UK, they're doing twice a week for all children and workers, people who go to offices, and that has been a dramatic difference in the outbreak. Okay, so again, you should choose the best test. Go to the MDA, Malaysian Device Authority site to choose the ones that are reliable. Okay, I have come around to doing this. I believe all children should be vaccinated before we go back to school. Again, remember, we can only vaccinate up to 12. So my game plan is, let's vaccinate all our children 12 to 17 right now, and don't go to school just yet in October. After all, it's just a very short period before school ends anyway. And then in January, we can send our teenagers back to school, and let's work to fix our under 12. And I'll talk some ideas about this, okay? And for ideal, we should optimize ventilation even more. Earlier, I talked about basic ventilation. To optimize ventilation, you need a carbon dioxide monitor, and you need portable air cleaners. Let me talk a bit more about ventilation. Okay, so it's airborne, 1 to 2 meters is a little value indoors unless you improve ventilation. Okay, and so windows and doors, I talked about avoid cross staff. Use a portable air cleaner. I've got one file there talking about air cleaners and some data on which one work. The aim is to be able to exchange 4 to 5 air exchange. The whole room air can change 4 to 5 times in an hour. That is the target you're aiming for. But there are good air cleaners which have HEPA filters, They suck in the viral particles and then give you clean air. That's even better still, okay? CO2 monitors will tell you whether your air cleaners are working. You don't need very many. Let's say you got 5, 6 classes, you can invest in 1 or 2, and then you can put them there. Put them there when people are there. Maybe the first thing is for teachers to come back, have a classroom full of teachers, and test what it feels like. There are 15 teachers in the class or 20 teachers in the class, and watch the CO2. The CO2 level goes up. This is a proxy indicator of air particles. CO2 level goes up, then your air exchange is not good in there. In the toilets, make sure the exhaust fans. That's one of the most dangerous places, the toilets. Okay. For the air conditioning, what some people have done is put in UVC, ultraviolet C, into the air condition to kill the viral particles. Others have put in HEPA filters. Air cons recirculate 70% of the air, so they just suck in the viral particles and spreading them out in the room. So if you don't have this, turn off the aircon. Use a fan is better than this. But a portable air cleaner and aircon monitors, and not just any old air cleaner, not just any air purifier. Many of them may not work. You need one that can do large volume air exchange. All right. So I've got this resource for you. I've got a couple of them inside there. Even one Malaysian guy who reviewed local air purifiers. But I like this one. This is from Harvard. It's very good. And the bottom, the different section is an Excel file. They've given you a calculator even for the size of my room, what kind of thing I need. And they give you also devices that I think are useful. All right. I've also given you a study from an Australian hospital where they try to see how they can clean the hospital room with air purifiers. Okay. Now, the tough areas in school, I don't know what to do about. Bus transport. For people who are poor, who are coming by bus, we need to work on it. You need to improve the strict masking, maybe do a double run, smaller numbers coming, better ventilation. Don't use the aircon, open the windows. Okay. That's one issue. The toilet use, it's one of the most dangerous areas. Don't unmask the toilet. Sometimes people don't want to wash their face, is a problem. Ventilation fans, I said, are important there. Keep running all the time. This is the place where you actually want to clean surfaces more often and see whether you can improve your ventilation. And then the break and recess time. This is the time people unmask. When you unmask, when you get infected, even doctors and nurses in the hospital, when they go to the pantry to eat, that is when they get infected. So don't want to eat together. So sad, huh? We love to eat together. Unpack our nasi lemak and sit down together and eat. But right now, you want to have children actually eat outdoors if possible, not indoors. You want them to go out, find a quiet place, give them the space to go and eat. Do it by class batch, so that it's spaced out. Consider a packed lunch so you don't have to go and queue up at the canteen to go and pick up lunch. Okay, and don't forget children who come from disadvantaged families who may not have food, and these meals are very important to them. Okay. Now, for some of you who've got running home-based services, home tuition or whatever, I've also got some ideas there. Okay, and I want you to go and read them. I'm not going to go through them right now. And I've also got this DIY ventilation fan that you can carry around with you. It's called a Corsi Cube by a man called Corsi, who suggested how we can produce a cheap one. Very hard to find in Malaysia now to make one, because since I've been advertising, the filters have all been sold out. But maybe there may be smart people who can bring the filters in to make it. This is a very cheap, reliable thing. The details and videos, how to make this, are all in the file on the ventilation file. Okay. So fix schools and vaccination before opening. So this is talking about 12 to 17. My plan for 12 to 17 is vaccinate them now before the end of the year. At the same time, fix all your schools, get your masks in place, and your mask strategies, your ventilation strategies, your distancing, your class bubbles. Please invest in weekly RT antigens. Plan your hybrid schools. Involve your parents in all the decision making. So it's a corporate plan, and we work together to get this done. All right. If parents refuse, you have to think through. These ethical issues. I'm not going to get my child to wear a mask. Should they come to your school or not? Oh, very difficult decision. I do not know what to say. This is a difficult decision. Some schools in the US not letting them. Other schools said, no need to wear masks. It's a very difficult decision. What about preschool and kindy? What about primary school? Fix the schools. The same things I talked about. Fix the schools. If you can do weekly RT antigen without vaccination, you are very, very, very far ahead if you can do that. Okay. And the problem is that tiny school children putting a swab up their nose is a little bit messy and tricky. Huh? There are new kits coming up where you can gargle and spit out and use that. There's another kit coming out which is a lollipop kit. You actually suck it like a lollipop and then you test it. That's what they're using for children in some countries. Haven't come to Malaysia yet. And I think we should expedite some of these kits for the smaller, some of these kind of test kits for the smaller children. Okay, but primary school children, I think, can tolerate some of this. Again, we don't want to do this too violently and choose the best kit. Right. I'm ending, and we'll take questions. And I'm sorry if I take a bit longer. I thought it's important to cover in more detail. And I'll show this to you because we need to live. Okay. Whatever the COVID is, these are all the birds, a few of the birds I've seen this week alone. All right. Some of the birds in Ipoh and some of the birds on a drive closer to the mountains, still within Kinta district. So I maintain my SOP and my guidelines. Lovely birds, silver Lemisia, the star bird on the mountain areas. Bee eaters always in my house, these fellas, lovely rascals, Java sparrows and stuff like that. And here's me always watching sunrises, a sunrise from the rooftop of our house. You need to keep alive. You need to keep your children alive. When you talk to our children, play with them, interact with them. Otherwise, I think there is going to be a lot of difficulty with them long term, even when you come out of COVID. Back to you, Rebecca.
Thank you, Dr. Amar, for that session. I'm just going to get Reverend Elisha to come out to share something.
Hi, thank you so much, Amar. I think that is, even though it's a lot of information packaged in less than an hour, but just to let everybody know, this will be available on YouTube, correct, team? This will be available on YouTube. So please go and use this resource, send it out to others, and let's see where we go. On Dignity side, we kind of we are in the tug of war, isn't it? We not only parents, Trina and I not only have our own 2 children, we actually foster 20. We care for 20 more from various ages. So just imagine as parents and as the ones who run the school, we look at all these different challenges, and there are so many practical things that Dr. Amar has brought about and challenges which are very real. I think one of the key things is the participation together. Parents, teachers, children. I think we cannot do away with this from this partnership. It is very critical. And taking the conservative measures of being anal about caring for yourself and those around you. Now, if you need to know more about Dignity, please go to our website. We started something called, the conspiracy of kindness. So we did a little video called Raise the White Flag, Color the White Flag, which not just getting resources for the poor. I wanted to say that, the resources for the poor are so critical. So visit our website, the different people who are doing it. Let's all do our best and really see this turn around. So we appreciate that, appreciate an amazing team at Dignity. And as we are educating, I really like what you did at the end, Dr. Amar. Your mental health, my dear friends, is important. Enjoy the sunrises, the sunsets. I take a lot of pictures from my balcony of the sunrise. Enjoy watching birds. We have our Dignity Farm Academy in the farm in Bentong when we do our work there. I enjoy hearing birds and watching birds as well and working on the ground because we need to maintain a healthy mindset in all that we are doing. One last thing before I pass this on to Rebecca, don't pass on wrong information. I think we see a deluge of that, and only good factual researched information, pass it on so we don't cause anxiety and further mental distress to people. So all of you amazing people who have come aboard today, thank you. Let's continue the conversation. And right now, we're going to have a time of questions and answers. Yeah. So Rebecca, I pass this time back to you. And just in case we don't have time at the end, Dr. Amar, thank you so much. Amazing time. We need to do a few more of this. Thank you.
Okay, Rebecca, let's go. There's a bunch of questions. Yes.
Thank you. Thank you, Pastor. Thank you, Dr. Amar. Yes, let's get started. So we actually, as Dr. Amar mentioned earlier, we have about 80 questions that we receive. And the highest is actually, interestingly, I mean, shouldn't be surprised, but we have about 43 questions that are in the area of should the children be vaccinated? So the age, the side effects, the brands. And I trust that from the briefing earlier, most of the questions have been answered. The second highest is actually in the school reopening. So in terms of SOPs, compliance, enforcement. So we are going to share screen on the Mentimeter of some of the questions as come out during the briefing itself. So this one has quite a word. So should children under 12 be vaccinated? So I think this has actually been answered. Dr. Amar, is there anything you would like to add on to it?
We will. I mean, I'm reluctant to. I'm reluctant to vaccinate children unless we need to, but I believe that we will come around having to do this. Okay, because Delta is not going to stop. Yeah. Carry on. Next.
Why all parents and school staff must be vaccinated, despite the data that people are not really protecting others by not spreading the virus, as they also will be contracted easily.
Yeah, so let me explain that very clearly. Notice only 1 in 3 of those who are vaccinated will have a breakthrough, not all of them. So 2/3 will have no breakthrough infections, so they will not spread. Of the 1 in 3 who get the virus also, their duration actually is smaller. And there are some people who are now doing studies to see whether they are more infective or not. And it suggests that they're not as infective as people who haven't got the vaccination. So definitely the vaccination is protecting the community from spreading the virus. So I don't agree with that about not spreading. You can spread, but your risk of spreading is a lot lower than people who are not vaccinated. Next.
This is quite specific to the dosage.
Yeah, would you look at the file I gave you, KKM? I cut and paste my slide exactly from them, from their website and page. Huh? Okay, so I suggest you look at the KKM file. So right now I'm not access to it, so I don't want to give you a wrong answer. Okay, next. Oh, no answer at all yet. Let me tell you what I think is going to happen. The Pfizer data is going to come up first. So many countries are going to go ahead and use that because they are worried, just like I have expressed my concern about children. Huh? But other vaccines are going to come up. So it depends how urgent our problem is, whether we're going to wait or not wait. We are somewhere in between where countries are. We're not the fastest moving countries in the world, but we're not the slowest country as well. So I would also watch what Singapore is doing as well. They're good partners to look at. Yes.
This is on a breakthrough infection. What else can we do? So we talk a little bit about the Swiss cheese model.
This worries all of us. Why we still get breakthrough? We follow everything so rigidly. I look at data quite a bit, and I like some people who do very, very detailed work. There was one from Australia where people were walking home together from school, and then just that walk home together infected the fella. I suspect they weren't wearing masks for that one though, and they chatted and they did. But if your mask is not tight, not a good fit, you're going to leak. There is a 25-30% leak actually. So things can come in and can go out. So it depends how long you are. So if you go to, let's take situations. I go to Tapao Food for lunch for my wife and me. I go to the coffee shop. I sit at the edge. I don't even enter. I scan, and then at the edge, I give my container to the fella. He gives me my food. And I go off. My risk is very low because I'm in open air all the time. I don't talk. But I go into a shop. I have to wait 15 minutes to get my food. Oh, I think that's a high risk. I never do that, by the way. I wave at people inside the shop. They come out and get my container. I scan from the outside. Then I wait outside. Even the sun also, I don't mind. I wait outside. Good to get some vitamin D also at the same time. So a lot of it is our exposure risk for getting it. And I feel for these people, the people who are our frontliners, not just medical staff, but the policemen, the counter staff, the ones who's working in the food industry, supermarket, they are the ones who are going to get the most breakthrough. Should vaccines be mandatory as part of SOP for school opening? I don't like anything mandatory. I don't think we should force anybody. I think we should encourage people. The problem is, if you cannot control this pandemic as it gets worse and worse, then people are going to start pushing mandatory. I can tell you that other governments are starting to do this, and our government will also think this. And other parents will say, "I don't want your child here. He's not vaccinated." All these kind of issues will turn up, sadly. So I think let's not try to make it mandatory. Let's see whether we can vaccinate as many people as possible. But I do think that vaccination is important before school opening, but that can only be done for the 12 to 17. We still have to have other important measures for the younger ones. And as I suggested, one important measure besides fixing the school and ventilation is rapid antigen testing every week, which is an expensive thing to do.
Yeah, so Dr. Amar, about the RTK antigen tests, you mentioned that ideally we should get it tested every week. What is the current pricing? Because I know the government actually has subsidized, has lowered it slightly, but is there an alternative to that? Let's say a school is not able to do that on a weekly basis.
Anything less than a weekly is not useful. Actually, twice a week is what most people would consider more meaningful. The prices come down to between about 15 to 19 ringgit right now. But I know colleagues who can bargain the company to get 8 ringgit. So I think if you're buying in bulk, you can come down in the price. Okay. Okay,
let's move on to the next question, shall we?
Yes.
Okay, this is quite specific, I think, in terms of peanut allergy.
Yeah, again, you need to look at the Ministry of Health guidelines, and they will assess your risk when you come. This is the kind of child that you must tell the healthcare professional, hey, my child's got peanut allergy, and they will assess the degree of the peanut allergy. If after eating the peanut, all he had was a little bit of a rash, that's very different from after eating the peanut, he choked, his airway was swollen, he couldn't breathe, he turned blue, he wheezed, he had to be in hospital. Oh, that is the kind of child I will give the vaccine to you in hospital. But the one with just a simple rash, I think I'd be happy to give it to you in the clinic setting. Okay. Generally, people are going to be more and more conservative with children than adults, and even moderate allergies, they will prefer giving you in a safe place. I think people don't fool around with children as much as they're happily to vaccinate an adult who's more robust in a clinic setting. Carry on.
Masks for children, especially.
Again, we must always assess with children how they feel and what to do. Why do I wear a KF94? Because I can breathe better. I also find the double mask a little bit stifling. Sometimes you wear for a long time. I don't know how people wear the N95 for the whole day. I try wearing also, very difficult. I sympathize with my colleagues who are working in the difficult areas like casualty or an ICU where they're wearing this, for many, many hours. So, buy a mask that has got good filtration and breathability. Worst come to worst, it's a single mask, isn't it?
Yes, I think for children especially.
Yeah, a single mask is better than no mask, let's face it. But I would then try for that child to boost him with a good face shield. A good face shield is one that wraps around your face and wraps around the top, so that air is pushed downward rather than out and from the side, okay? So if you can find a face shield like that for children and they could wear that with a single mask, that'd be better than just a single mask alone. But if you could wear a double mask with a face shield, good. Okay. There are KF94 masks produced for children from Korea as well. I sometimes look at these countries because they're further ahead of us in thinking this through.
That's true. And we know children, they always pull down their masks, especially the younger ones. So we have that situation in school as well. So I would agree with you. If they really can't take the mask, maybe a face shield would help.
A face shield prevents you from touching your mask, or it gives you sort of a reminder kind of thing. Yes. Carry on.
Especially with all the shopping now, online shopping now.
Don't know how to answer this. Plastic, of course, the virus lasts longer than organic food. In the early days, we're a bit more concerned. Now, my wife and I are less concerned. What she will do is, when she comes back, she uses the back entrance to the house, if you've got one that's nice, and then she uses the back sink. She removes all the packaging and trashes that, then washes things. If it's a canned thing, she just wipes it down. You might want to wipe it down with alcohol wipe or something like that. But I think you cannot do that for raw food because it's not good. At the most, you just wash it. So I think let's not be overly done about this. Just some simple precautions. The packaging, I would trash definitely, and then wash my hands and put the stuff in a safer container. Next.
Okay, siblings across the classes in one school. If one class is shut down, what about the other siblings in another class?
So this is looking at two different ways. One is if one sibling is the one who's in contact with someone infected or is the infected one and his class shut down, of course, the other sibling's class will also shut down automatically, isn't it? Because the other sibling is also a risk person and will have the same exposure. Right. But this is saying, okay, so let's say Andrew in my class got high risk, either infected or his parents got infected or he's been in contact. So you're shutting down my class because, you know, does my brother in another class have to be shut down? You know, I think right now, no. Of course, if you've got weekly antigen kits, then the other class is very, very secure. We know exactly what's happening. You know, no, I don't think so right now.
Okay, thank you.
Very practical question.
Yes.
In the UK report, not only they do not encourage 12, even 12 to 15, they don't encourage routine COVID vaccine. They only encourage 12 to 15 with a disease. That means you've got diabetes, or if you've got, you know, heart disease or lung disease or immune compromise. They think the benefit. But that is only the opinion of some of the UK authorities, the ones who are making the decision. I can give you a video to watch, which is all the major pediatricians, public health people in the UK, the SAGE, independent SAGE, people who are very, very high quality, who are all very annoyed with this decision and are saying, please don't take this decision. And the reason they have been okay right now is because of the school break. And this week, when school started, they already got to see the spike. So I think the next 2 weeks may see a revision of this decision for UK. So we're all watching UK and trust that this is not the opinion of the majority specialists. It's only the opinion of the minority. You must recognize that government is always about opening up. Government wants to just get things back. But COVID doesn't care what we think. COVID cares only about how we behave.
That's very true about UK. When last month, when the school reopened in Scotland, immediately you can see the cases spike up. So it's something that they just learn to live with it. So it's interesting, but I do agree with you that it's too early to just dismiss that the benefits are more minimal than the risks. Can we move on to the next question? Okay, this is about breastfeeding for moms.
Yeah, I think there's good data now that it's safe to breastfeed. I have put one more file inside the online link. If you can download that, that's for breastfeeding and pregnant women. And, you know, both are now recommended to be vaccinated. Okay, so have a look at those links. They'll tell you who are the small groups of people they don't want to vaccinate or want to vaccinate or delay a bit. But definitely, we are recommending breastfeeding moms get vaccinated. You may produce, and you will produce antibodies, and they will come through the breast milk to the baby and protect the baby.
Due to time constraints, we will probably take another 3 more questions, if that's okay.
Rebecca, why don't we continue a bit more if the questions are good? Okay, I don't really mind. Let's carry on.
Thank you so much for that. Yeah, we just want to be mindful of the time.
Sure.
Okay, so let's.
Yes, this is a good question. Yeah, this is a good question. How sensitive about RTK antigen and saliva home kit? Can a negative result be a false negative? Yes, it can be. Again, the ones that are online with the MDA, Malaysian Device Authority site, are the ones that are approved by our government to use. You shouldn't buy outside that. But even there is a range of kits. I think the best is to get to know your doctors and ask them, hey, which one do you think is the best one? I don't want to mention any brands here, but we know which are better. But, you know, any test that we do is only 70–80% reliable. You must recognize it. Even the PCR, it depends when you test it in the illness and how good your sample quality is. If your sample is poor, you might get a negative test. You test too early or too late, you're going to get a negative test. Okay. So, you know, that's why we talk about weekly. But if you do weekly, you're going to pick everybody up after a while who's positive, and that will be a good means if you're doing that. Okay. So yes, it can be a false negative. Next.
Okay, I'm going to pick some of the questions that they sent
Okay.
pre-workshop.
Okay.
So this is regarding about schools. So it seems that biggest risk seems to be recess when kids need to remove their mask. What options do we have?
Yeah, but that's the practical one that I discussed earlier. Again, as I suggested, one, break the children to meals at different times. Two, make sure the lunch is already prepared so you don't go to queue up anywhere. Three, have them eat in separate locations. If it's outdoor, even better still when they take off their mask. Of course, children need to, when they take off the mask, must clean their hands. When they put back their mask, clean their hands again. One other option is have shorter school. Makan before you come, have a shorter school and go home. So you don't need to makan at all. I mean, that's another option as well. So I think we have to think this through. But that is the highest risk time if they talk to each other with the mask down. Yes, Samo?
Okay. Will the fact that more than 80% teachers have been vaccinated make our school-going children safe from serious effect or illnesses?
I
Is
think
it sufficient that
it is good, but not sufficient. Don't think it's going to prevent a Delta spike in our children. If only the teachers are vaccinated, I think you'll have to do the children as well.
Yeah, that's very true. And what is the significant difference between vaccinated and non-vaccinated children who attend to school physically after the precaution measures are taken?
Say that again, Rebecca, one more time.
What is the significant difference between, let's say, if they go to school and my child is not vaccinated and another child is vaccinated? What is the risk?
The child who's vaccinated is helping to protect your child because he or she is reducing the chance of Delta spreading in the school. And so is the teacher who's vaccinated. You noticed recently the Education Ministry was unhappy with teachers who didn't get vaccinated because they're worried about the same. The Ministry of Health is worried about any health staff who choose not to get vaccinated because we are facing so many people every day. So I think a teacher unvaccinated is a higher problem. Let's say we come to the place where 90% of parents take the vaccine, but 10% of children don't. Actually, I'd be quite happy. That's pretty good. We can protect. It's better if all of us take responsibility for other children. That means I do this for my child to protect your child and my child. You do this for your child to protect my child and your child as well. But if sufficient children are vaccinated, definitely the few who don't get vaccinated, either because they cannot, they've got some illness or some problem, they cannot get vaccinated, or they choose not to, we actually will be protective towards them to some degree. But Delta, look at the Australian study, at 90% still can spread around the community. So we need to be aware that you can still get infected if you're not vaccinated.
Do you think we should be concerned about, now they're circulating about variant 2022, COVID 2022, they call it. What do you think about that?
Right now, many of us are watching all of this. That's also Lambda and Mu variant. They haven't seemed to be able to overtake Delta just yet, in any location. I think because Delta is so infectious. But when Delta burns out, then you have to start thinking about these, especially one that can evade a vaccine, that can bypass the vaccine protection. That is the kind of variant worry. You must remember, we're talking about Malaysia, we're talking about US, UK. What about Africa? Some countries less than 0.5% vaccinated. This is the place a new variant may develop and then will come back and bite us, come back and hit us hard, which is why we must think of the whole world as one community. We must support other communities as well. Otherwise, we may damage ourselves by doing that.
Okay.
Rebecca, if you don't mind, there's some in the chat group that I'm just going to quickly look at. There's one about children with special needs in Sekolah Khas. Same criteria, Faiza, who asked a question, but they are even higher risk of getting severe COVID. So I would vaccinate them first, the ones in children in Sekolah Khas, to give them the thing. I noticed that, MOE is Ministry of Education not so keen to bring them back to school even last year when other children could go back. Now, I don't think we should segregate these children, but vaccinate them earlier first. I think even now the plan in the nationally is that children 12 to 17 who have chronic illnesses or disability get vaccinated first. Then we do the rest of the children here.
Okay. If you're able to take on more questions, we can.
Yeah, there's one here from Siu Sang saying, my children who are 17 and 19, no confidence to go to school, even though they're fully vaccinated. Yet we're worried about the age of 9 who are yet to be vaccinated. Yeah, it's a problem. Susang, a lot of parents have talked to me, they don't have confidence in the school, which is why, remember, one of the points I put, parents working hand in hand with school authorities. The school authorities are prepared to do this. If we cannot trust the school, then we won't send our children. So I would encourage all teachers at this time, work with the parents.
Yeah.
Parents also bring resources. If you don't have enough money for hand sanitizers, maybe parents can put together a fund. We can help that for the poorer kids, especially. I would expect a hand sanitizer outside the class where everybody would use just before going in, for example. So there are things that parents can do with children. That's the only way to boost trust. Trust is very, very important about this right now. Yep.
That's a really good reminder, especially as schools working closely with parents.
Yeah.
We are going to maybe look at a few more questions on Mentimeter.
Okay.
We are vaccinated, but my kid is not vaccinated. However, getting COVID is better than getting heart disease. Perhaps this parent is worried about the side effects.
Yeah, as I said, looking at all the data, it's a higher risk of getting damage and death and heart disease with COVID than with the vaccine. Okay, I'm not saying you're not going to get some children are not going to get side effects from the vaccine. Yes, they are, but the numbers are very, very much smaller than with getting COVID. Okay. Yes.
I think we can move on, Felix.
Yes.
Thank you. Can a COVID patient who has recovered catch the virus again?
Yeah, a couple of them have. We've seen that happen. There have been published data, in journals where people have documented, and they do genome studies, so they're very sure you got the COVID and then you got it again. Sometimes it's maybe a different variant who's causing it, but it's not common at all. This is uncommon. Okay, it's a minority that it happens to. Usually, people who are immune compromised, the immunity is lower. The ones who have this happen.
That's correct. I think people might suffer more from long COVID than to catch the virus again.
Agreed.
Okay, let's move on. Thank you, Felix. Okay, the real question is children psychology below 17 years old. Once school open, they will have problem limiting their socializing. True. With strict SOP, there will be some who infringe. What's your view?
Agreed. And we all want to get back. We want to meet our friends. One girl asked me, when can I hug my friends again? I feel for her. She's 12 or 13 years old. So I think all these are issues. So in the earlier SOP that I wrote last year, which is why I put it there, we talked a lot about talking to children, about helping them understand this, about having new mechanisms to meet with children. For example, if I'm a parent right now, I would use Zoom, Google Meet, or other things to have a few children meet regularly, maybe twice or 3 times a week. A big Zoom is no use. It's very hard to chat, but maybe 5 children who are regular friends meeting on Zoom to chat, crack stupid jokes and laugh a bit, as a means to maintain their socializing using online media. I would never have suggested this pre-COVID. Last time I was not so screen, friendly for children, but now we can use this for our children. That's one other thing maybe I'd like to suggest. I've been talking about COVID bubbles for families. So it's about 3 or 4 families getting together. So here's how it works. First of all, you're all trustworthy. You know each other very well. You know that each other are very reliable with their SOPs. Secondly, all the parents in the families, all the adults in the families are vaccinated, including grandparents. Thirdly, you're prepared to do 1 RTK antigen every week. So you do RTK antigen, everybody negative. They meet in one parent's house, and the children can talk and gab about and play, and you can do that once a week. And that might be a means of getting socialization outside school. But it's the same group of people who meet again and again. It's like a support group kind of thing, because definitely psychologically, we need to think about psychological impact on our children.
That's true.
Any more there, Rebecca?
Yes. Felix?
Okay.
Okay. How about Ivermectin?
Always we get this question asked, and I've tried not to say too much about it. Okay, I'm a data person. I look at evidence. If Auntie tells me, Amma, I took what is it, star fruit juice and my diabetes is gone. I would say, Auntie, I need some evidence that the starfruit juice worked to cure your diabetes. I was told that actually many years ago by somebody. So you and I mean, some people smile. I could see in your video, some of you smile when I said that. So we need evidence. So right now, there is a couple of authoritative evidence. The Federal Drug Authority of US, very, very good group. The National Health Service UK, another group. The British Medical Journal, a group I trust very much, and the Cochrane Review, the one I trust the most. Cochrane Review is a site dedicated only to evidence. All of them have reviewed all the evidence of ivermectin and said that there is no evidence that ivermectin should be used routinely right now to prevent or to prevent you getting COVID, or to use when you get mild COVID to prevent you getting severe COVID. There is no evidence for this. 2 of the COVID studies were falsified. 2 of the large ones.
Oh, wow.
Yeah, one from Egypt, which was looking very good, but we found that the data was all cooked up under the coconut tree, and that actually has damaged the ivermectin lobby considerably. Huh? So again, follow the data. Look at the Cochrane Review. The Cochrane Review says currently there is no evidence. It's not that people are dismissing ivermectin. They say we just need good evidence. Right now, the studies are not good quality studies. Okay, next.
Are vaccinated people potential COVID-19 spreaders? Does this mean that vaccinated people at home can be infected if we carry it home even though we are vaccinated?
Yeah, as I said,
Definitely.
I would treat COVID vaccinated and uncovered vaccinated the same right now. Huh? So let me again summarize in case the message didn't go to go and I've given you a wrong idea. From the data right now, 1 in 3 of the persons who have been fully vaccinated with AstraZeneca and Pfizer can get a breakthrough infection. Right? But the majority are spared from severe infection or hospitalization. They just get a breakthrough infection. The breakthrough infection doesn't seem to be as infective as the person who is not vaccinated, but can still infect other individuals. Okay, that's the kind of summary that I like to say. So yes, we should still take precautions. Yes.
At this point, I would like to highlight, you mentioned this quite a bit in your articles and fact sheets that you have given out. You mentioned the information regarding COVID-19 changes rapidly and is very fluid, especially regarding the size and impact of the outbreak. I like this part. Hence, what is said today may need to be revised tomorrow. And that shows just the data, like you mentioned, whatever decision that we make, it is very important to look at the data, to look at the science of things.
Yeah, Rebecca, last year, people weren't talking enough about masks and ventilation. Now it's all masks and ventilation. I was doing an Astro Avani talk yesterday, and Melissa reminded me that, last year I started talking about ventilation because the data was starting to emerge. But now it's really true. If you don't fix ventilation, don't go back to the office or your school or your factory. Full stop. I think that's the minimum that we could say. So that kind of data is really good data and we should follow it. Yes, next.
Okay.
I'm trying to cover as many people as possible.
Yes.
Yes.
Felix, can we have the next one, please? Yeah. So we have quite a bit of repetition. So Felix is very kindly helping us sort through it. But let me just also look at some of the chat box.
Why do we end the screen? Okay,
sure.
There's one here. Okay.
KKM to make it mandatory for all. So this is a suggestion.
I fully agree with you. Please talk to them. Please write in the media. Please advocate for this. Okay. Why don't we stop the screen right now and see the chat so we can have a look at the chat as well. Yeah. Okay. There's somebody who's posted a little bit of data on Sinovac in children that I had missed. Please have a look at that.
China,
somebody posted that. Please have a look at that. Is our government considering AZAC vaccine for 12 to 17? There is no data yet right now for AZAC vaccine in children widely available. Having said that, I must say that, recognize that the younger they vaccinate AZAC, when they come down to below 40 and 30, they saw more bleeds in the brain. I would expect, looking at the data, that as you go even younger, that risk may be even higher. So AZAC, I think they had to show very, very good safety profile before we use it in children. We're happy to use that in people past 40, but not younger individuals.
Somebody mentioned those who completed Pfizer vaccine, can we purchase Sinovac for booster? If yes, when should we get the booster dose?
Yep. Okay. I have had slides on booster. I didn't show them because they're largely dealing with adults, but let me summarize that. the data. Now, if you're immune compromised, what does that mean? If your immunity is not good, you're on some chemotherapy, on drugs that drop your immunity, or even some people with severe diabetes and stuff like that, talk to your doctor. You should receive a booster. Which booster will depend on which vaccine you got. All right, that's the first thing. Sorry, not a booster, a third dose. These people we don't consider booster. We consider a 3-dose schedule for anybody who's immune compromised. Okay. Now, for the remainder, should we get a booster or not? The data is still not clear. AstraZeneca, the Tahan Lama vaccine, the data is very good. Right now, no booster recommended. Pfizer, unsure. Some countries have started, but the data is actually very unclear right now. Right now, no yes, no yet. But Sinovac, the data seems to suggest that may need a booster. I think, as I said, Sarawak will give us the answer from UNIMAS, and the Sarawak government in the next couple of weeks are looking very hard at this, and we may give the answer more than other countries do. If at that point, I wouldn't use a Sinovac booster. If I 2-dose Sinovac, I'll use Pfizer or AstraZeneca as my booster. Now, if you're 2-dose Pfizer, should you get a Sinovac booster? I can't answer that question because I haven't seen the data. I have seen the data that after 2-dose Pfizer, you get a AstraZeneca. Yeah, it works. So those kind of boosters, there is better data for them. So again, read the hard data for the booster, which one works. This is not, I go to the shop, I don't like the socks, I buy another pair of socks. All vaccines have side effects. Vaccines, some boosters may not work. I think we need to push people to give us the evidence that we know what works.
There's a few questions on children. How do we keep the children below 2 years old safe because they can't wear masks? And is it safe to bring them out jogging without masks?
Good question there. Okay, so let's take the second one, which is easy to answer, going outdoor. Yeah, please, we need to see the sun and we need to touch the ground. It depends where you live and how you live, So let's take my neighborhood. I live on a dead-end street, thank God. So my wife and I wake up very early. We're on the dead-end street doing our physical activity. Nobody is there at that time. Our airspace is our own completely, okay? Then there's the main street attached to our dead-end street. Our neighbors are sometimes up a bit later and they're going up and down. Some of them wear masks, most of them don't, and they're passing by. Would I be comfortable with that? I'm not so comfortable. If they stop to talk, I'm totally uncomfortable at all. I watch some of them talk actually, and that actually is not safe. So I would go to a play area with a child if I could, even if I could drive to a park and there run around, preferably alone, not with other children. That I would say is completely safe. But if you're walking up and down the street, there are also 7 or 8 other people also walking up and down the same street. With Delta, I become a little bit more cautious. With the previous Wuhan strain, I would have said, no problem, I'm not so worried. This one is a lot more infectious. Again, it depends on exposure risk, like how close we are, and stuff like that. It's probably quite safe. Would I want to wear a mask outdoors? Generally, I would like to avoid it. Give it a breather from the mask if you're in open air space. Having said that, if I'm bird watching and somebody else turns up, my double mask turns up immediately, or my KN94 mask turns up immediately, okay? I'm not going to take a risk like that because that fella may want to stand 2 meters away from me and chat a little bit, even though we're open air. I want to minimize my risk. Am I hyper? No, I'm just cautious, I think. I'm not hyper. I'm older, I'm 60 plus, I've got a cardiac problem. I'm just being careful about my risk, okay? Yeah, so what about how to protect the 2-year-old generally? I have no answers, Rebecca. I wouldn't take them to the cinema. Okay, I wouldn't take them indoor dining, no. But I would make sure that they got chance to mix with other children online at least, or as I suggested, a family COVID bubble between a couple of families. Yeah, trust bubble, yes.
There's a few questions on side effects. So I'm just going to try to summarize this and try to put it together, asking whether it would affect their DNA, make them sterile, whether they have immunity, if yes, for how long, any possible effects after the booster dose.
Sorry, I was replying a personal message there. One organization trying to get contact with me, all right? If that happens, Rebecca, and I fail to answer other organizations only, I'm not personal, individuals, you please filter for me and see whether they need to be in contact with me. Okay, so your question, which I didn't listen to very well, again, one more time, I apologize.
So there's a few parents who were asking about the side effects.
Yes.
So some were asking
about sterility and
right, severity and whether or not, how long it will last.
Yes.
And if they are to take booster dose, and we are proposing to say 3 shots vaccine in a year, what is the effect on their bodies? You did cover a little bit of that earlier.
I right now, as I said, nobody has seen any significant long-term effects of the vaccine. As I told you, most vaccines, all the vaccines in the world in the past always show this very quickly within the first 6 weeks to 2 months. Okay. I have not seen any data on sterility at all to support sterility. So sorry, I would say that there is no risk at the present moment.
Yeah.
Nobody can give you 100%. Even if somebody tells Rebecca, I'm sending my child to your school, you must make sure they pass all their subjects 100% guaranteed. Then when I come to your school, Rebecca cannot promise that. There are a lot of variables involved: the teacher, the classroom, the child, and so on. So similarly, nobody can promise you 100% that there are no long-term risks. At present, nobody has identified any long-term risk from any of these vaccinations. Will we need boosters routinely? I do not know. Okay, some countries have started. Some countries started for above 60, some doing above 40. I think these people are being overly cautious. As I said, the data for AstraZeneca is not there for booster. The data for Pfizer is not sure yet. The data for Sinovac is the only one that seems to be coming out that may need a booster. Even then, I would prefer getting some really good data from Sarawak experience, and then only we know. About 49% of all Malaysians have received Sinovac, so we do need to know that data. But it's not a vaccine at the present moment I'm going to encourage for children unless we see some harder data of its reliability, especially with Delta.
Okay, how are we doing on time, Dr. Amar?
We should be ending. Let's take 1 or 2 more.
Okay, let's do that, shall we?
Let's take one last one, Rebecca. You choose.
Okay, let's do one last one. There's quite a lot of number of questions, and I mentioned we probably won't be able to do all, but let's do okay, so there are quite a few comments that are thanking you for like fine. Any doubts that you have. Okay, so there's this message. I'm just going to choose. Okay, is there any major difference in effectiveness between alcohol and non-alcohol sanitizer? Because I think this would be quite practical for everybody.
I don't know enough. I wish our engineers and chemists and all would speak a lot more in the press. In fact, even air purifiers and air circulation, I wish engineers would get together in the country and come up with guidelines for all of us to follow. I'm just a pediatrician, okay, and a public health person. I hold 2 postgraduates, so I think that way. So the best place I would recommend you is CDC. Go to the Center for Disease Control, and they will tell you which disinfection works and which did not. Earlier in the last year, I had all this list. I actually showed slides on this, which disinfection work, hypochlorite and stuff like that. Like bleach works, but you don't really want to use bleach all the time. I mean, it's really caustic. So the 70% plus alcohol really works. We know that. And there are people who've done studies where they put it on their skin every few minutes for days, okay, to see whether the alcohol is absorbed. And very minimum amount absorbed. Toxicity is very low. So I can tell you that this is a fairly safe thing to use. Some of the other products, I want to see the safety profile. I see some people now spraying other people. Don't do that. I don't want these chemicals inhaled. That is not a safe thing to do. Some shops have got this booth. You go in and get sprayed. Please tell them this is not recommended by Ministry of Health or any specialist at all. People overseas will laugh at this kind of thing. Okay, so the air sprays and all, please drop. It's just a surface wipes. Or the if you're spraying alcohol on the surface and then wiping, that's a different story. But you don't want to spray an individual with any of these sprays. Okay,
thank you for that very good
Rebecca,
reminder. Yes, thank you, everyone. Thank you again, everyone, for your questions. I think it has been a really useful but I think we can also appreciate the complexity that comes with it. It's not a one straight answer and everyone will be satisfied. So we do apologize in advance if there's any questions that we didn't get to answer, but we trust that. I think one thing that I take away from this session is that read, right? Don't trust all the WhatsApp messages that is being spread around. I think we owe it to ourselves and our children to also read out and please trust, make our decision based on facts and scientific research. Before we end, I would like to take the opportunity to just share about our upcoming open days, where you can find out about our education programs. We will also have 3 other exciting workshops for you guys to join. So can we just have that out, please? Again, thank you everyone for joining us today. We are so privileged to have you.
Thank you. Thank you, everyone.
Thank you. Thank you again, Dr. Amar. Thank you, everyone, for
Thank
coming.
you so much. Fantastic. That was wrong.